So who is a good candidate for a facelift? This is something that really is up to the surgeon and the patient. Why? Because if you're looking in the mirror and you're able to lift certain things and you feel that you look more rejuvenated and refreshed, you might be a good candidate. However, there are other things that we really need to consider, and this is why you need to go to a consultation with a very good, qualified, and also honest surgeon. We don't use age as a number. I hear a lot of my patients tell me, oh, when I turn this many years old, I'm going to get a facelift. That's really not the case anymore. One thing we've realized about facelifts is sometimes we have people even in their late 30s. Now, I used to turn patients down just because of age, and I feel like that was a mistake because if somebody can really benefit from what a facelift can do for them, then why not? We do other surgeries. We do ear pinning, otoplasty as young as age 5 and 6 because it will help improve their appearance. We do rhinoplasty starting at the age of 15 and 16. So why not do something like a facelift if somebody can truly benefit from it? Now, when we get down into the different age groups, there's a lot of different details, and we discuss those in a separate section. But really, anyone who's a candidate is somebody who can really benefit significantly, not one of these tiny little pulls, because if you're going for this much surgery for this much result, you really have to consider if that's worth it for you. The other factors are you in generally good health? Of course, we're not talking about little things here and there, but is your diabetes controlled? Blood pressure, all those other things. Any issues with healing? Because if we're going to do a surgery and you have some sort of health issue that's uncontrolled, a bleeding risk, or you have to stop an anticoagulating medication, meaning one that increases bleeding, but that creates risk, this is elective surgery, this is cosmetic surgery. It's not worth risking your health. So a good candidate is somebody who, again, is in pretty good health, and we're not worried about increasing the risks of either healing or results or the patient's health in order to achieve the good aesthetic results. But in the end, to really find out if you're a good candidate, sit down, find a good surgeon, even go to multiple different consultations, and ask them, what do you think can be achieved with a facelift for my particular face? And then all the other questions that go with it, including the recovery, the downtime, and really find out for yourself if you think it's worth it.